Medical Communication for third semester students, Faculty of Medicine. Medical Communication. 1. Definition of medical communication. Medical communication is the process of effectively conveying information between healthcare providers, doctors, nurses, or other medical professionals, and patients, their families, or the medical team. Its purpose is to understand the patient's condition, explain procedures or treatments, and provide emotional support. In the medical field, good communication can influence patient outcomes, increase patient satisfaction, and minimize misunderstandings. 2. Functions of medical communication. Medical communication has several primary functions. 1. Gathering information. Through medical interviews, anamnesis, doctors obtain critical information about the patient's main complaints, medical history, and other supporting factors. 2. Delivering information. Explaining diagnoses, treatment options, risks, and prognoses to patients in a simple and clear manner. 3. Aiding decision-making. Guiding patients to understand treatment options so they can make decisions that align with their values and preferences. 4. Building a therapeutic relationship. Demonstrating empathy, attention, and respect to create a trusting relationship between doctor and patient. 5. Providing emotional support. Helping patients and their families manage stress or anxiety related to health conditions. 3. Aspects of medical communication. A verbal communication, using simple, non-technical language that matches the patient's educational level, ensuring that messages delivered are clear and well-structured. Example, you are experiencing a respiratory infection, but it can be treated with antibiotics and adequate rest. B. Nonverbal communication, eye contact, demonstrating attention and interest in the patient. Facial expressions, smiling and showing empathy. Body gestures, open posture, avoiding crossing arms, and sitting at the same level as the patient to create a comfortable atmosphere. Tone of voice, calm, gentle, and reassuring. C. Active listening, paying full attention to the patient without interrupting. Repeating or summarizing the information provided by the patient to ensure accurate understanding. Example, patient, I often experience headaches every night. Doctor, do these headaches occur every night or only at certain times? D. Managing emotions. Staying calm when the patient is emotional or anxious. Expressing empathy, such as, I understand this is difficult for you. Let's find a solution together. 4. Process of medical communication. Medical communication involves several stages. 1. Opening the conversation. Greet the patient warmly. Ask for their name and address them respectfully. Explain the purpose of the consultation. Example, good morning, Mrs. Sari. I'm Dr. Andy. What seems to be your main concern? 2. Gathering information, anamnesis. Ask about the main complaint. Current and past medical history. Family history. Daily habits. 3. Providing explanation. Use the following structure. Start by explaining the diagnosis. Discuss treatment options and the next steps. Provide information about potential risks or side effects. Example, based on the examination, you have hypertension. To manage it, we need to adjust your diet, exercise routine, and consider medication if necessary. 4. Managing patient expectations. Explain the limitations of treatment or the condition honestly but still offer hope. 5. Closing the consultation. Allow the patient to ask questions. Summarize key points as a conclusion. Example, so, you need to take this medication twice a day, reduce salty foods, and come back for a follow-up next week. 5. Challenges in medical communication. 1. Language or cultural differences. Patients may have different cultural backgrounds, requiring a sensitive approach. 2. Communicating bad news. For instance, delivering a cancer diagnosis must be done carefully while considering the patient's emotional state. 3. Incooperative patients. Anxious or fearful patients may be challenging to work with, requiring the doctor to be patient and build trust first. 6. Implementation in the third semester. In the third semester, students are generally trained in medical communication through 1. Patient simulations. Practicing communication with simulated patients, usually played by instructors or actors. Receiving assessments on communication style and empathy. 2. Medical interviews. Conducting anamnesis with simulated or real patients in clinics. 3. Role-playing. Students take turns playing the roles of doctors or patients to hone their skills. 4. Group discussions. Analyzing medical communication cases, such as handling difficult patients or delivering bad news. 7. Ethical principles in medical communication. Confidentiality. All patient information must remain private and not be disclosed. Honesty. Conveying information truthfully without being misleading. Empathy. Prioritizing the patient's needs and providing emotional support. Respect. Honoring the patient's rights, values, and preferences. Conclusion. Medical communication is the foundation of successful medical practice. By studying medical communication in the third semester, students will be prepared to interact professionally and empathetically with patients, effectively gather and convey information, deliver medical information clearly and tactfully. A deep understanding of medical communication helps students become competent, ethical, and empathetic healthcare professionals.